Thank you so much for keeping it right here on Sunrise at Sea. It's exactly 30 minutes past the hour of 7 and you are just in time for your beauty, wellness and lifestyle segment. And this morning we're going to be talking oral hygiene. Well, World Oral Health Day is observed annually on the 20th of March and launches a year-long campaign dedicated to raising global awareness of issues around oral health and the importance of oral hygiene so that governments and health associations and the general public at large can work together to achieve healthier mouths and happy smiles. Well, in Uganda, the Ministry of Health through the Division of Oral Health will be commemorating that day, and celebrations will be held today, Monday, the 21st of March 2022 at the Dental School Gardens in Mulago, starting at 9 a.m. So the all roads definitely will be leading there. Well, joining me at the center of this conversation is a special lady, and I will give her the honors to introduce herself. Good morning, Madam Juliet. Thank you so much for joining us this morning. I'll give you the honors of introducing yourself and tell us a little bit about what you do.
Thank you very much, Shivan. I'm Dr. Juliet Nabanza. My title is Assistant Commissioner for Oral Health at the Ministry of Health, and that puts me to task to give guidance on oral health services in the hospitals of Ministry of Health, and also work together with the professionals because they are the main stakeholders for oral health, and work together with other stakeholders who really contribute to improving oral health.
Well, thank you so much, Madam Juliet, for allowing to be a part of this conversation, and of course for the different initiatives that you're doing together with your different, in your capacity, together with your colleagues in regard to oral hygiene. Well, first things first, for the benefit of our viewer, what is World Oral Health Day?
Thank you very much. This is a day set aside to increase awareness among the public on oral health. If you'll agree with me, oral health is usually forgotten.
Yes.
Left behind.
Absolutely.
That is why our theme this year, the country theme, is Don't Leave Oral Health Behind. It is to you, Shivan, don't leave your oral health behind. It is to the general public. It is to policymakers. We need to really think about oral health and bring it back on board. The other year we had the theme, Bring the Mouth Back to the Body. It's like the mouth is an island, but we really need to work towards making sure that oral health is cared for appropriately. So today we create awareness on the importance of oral health to general health. As stakeholders, we share our achievements, we talk about challenges, we draft way forwards to improving oral health, and also give back to the public.
Okay, so looking at the fact that the government is putting forward different incentives, so what are the different avenues and advances that government have done towards creating awareness and prioritizing oral hygiene in Uganda?
In Uganda, first of all, the government put services at health center, at facilities, health facilities to the level of health center 4. 4 upwards, you can get dental treatment, you can get oral health education, and on top of that, we have activities that are arranged to go to schools to have children screened for oral diseases. Usually we hold this day in schools, by the way. Maybe it hasn't been so much in the public because we target them when they are young to grow up knowing what to do. So because schools are out of circulation, we can't access them due to COVID, we have come to the public. And we want to now offer to the public as compared to the schools. The government is offering a basic minimum care package, as we call it, and within that we have dental treatment for simple fillings, we have extractions if the tooth is beyond repair, we have cleaning, and that is the avenue where we offer oral health as government.
He talked about those different procedures, and I almost started shivering. One of the worst places I never want to visit is a dentist. However, still in that regard, so how does oral health affect an individual's health at large?
Generally, oral health, everything that goes into our bodies goes through the mouth. If you are not able to use your mouth to feed, to do the basics, you are considered very sick. So the mouth has to be healthy for your body to be healthy. If you want to take food you have, however nutritious, and it can't go through the mouth, you will not be able to benefit from the nutritions in that food.
Okay.
So generally, we used to have a good scenario. I call it good because it showed us what the body was about. During the HIV era, the body had a lot of indicators in the mouth. It would throw the indicators of the infection in the mouth. You'd see candida, and before this patient tests for HIV, you'd highly suspect them to have HIV infection. So the body already is talking through the mouth. The body can say, probably, I don't have enough blood, and you catch it in the mouth. The dentist, if they are very keen, they could be the first person to see that this person's general health is not very good in terms of levels of blood that they have. So there are many related factors. Pregnancy is another way that comes through in the mouth. Pregnant mothers really have issues with the gum. There may not be issues with the teeth, but their gums react due to those hormonal changes. You find gum swelling, and because of the whole environment they are in, they may be lazy to brush. That comes along. They throw up a lot. Some throw up a lot. So the body will talk maybe to the dentist through the mouth. Mm-hmm. And it is very true that general health is impacted by bad oral health.
Okay, so let's look at some of the key practices that one can keep to actually keep good oral hygiene, right from the practices, but also to the types of food that we should and should not eat.
The key practice is get rid of that food when it's still soft.
Okay.
Because brushing is the mechanical way of removing, but a simple procedure as rinsing right after your food will cut the food on your teeth or the sugar on your teeth to half or even quarter. Because if we say brush, someone will say, I'm at work, do I carry my brush everywhere? Mm-hmm. You may if you can, but if you can't, there should be something you can do really. Rinse out that food. The longer the food debris stay on your teeth, the quicker the damage, or the higher the risk to get damage. So when it comes to what you eat, I don't want to say don't eat sweet things. I want to tell you what to do after eating the sweet things.
Sweet things, yes.
Because people will eat them under the table, and we'll see decay, and we say, where is it coming from when we say don't eat sweet things? Yeah. But we want to teach people what to do. First, reduce the frequency. Don't make it a habit of eating sweets like you'd eat popcorn, because sweets have damage. Really, interesting. Really, reduce the frequency. Choose which sweets to eat. The sticky ones are more dangerous. Mm-hmm. Sticky. If your sweet is sticky, you run a higher risk. Mm-hmm. If it is a sweet that just rolls through the mouth and you don't have a lot of sticking, it's not good, but it's not as bad. Then we want to tell people that every time you think you want to eat something sweet, make sure immediately you can get rid of the residues. Yes. So we actually want to start a program, and we hope to work with Harris International on that, because people will say, how do you work with Harris when they have sweet things? Yes. They teach people how to enjoy the sweet things. If I can borrow a leaf from the breweries, alcohol breweries, they put it there, but they tell you if you are under 18, don't touch. Yes. Don't touch. So there should be a way of guiding people on how to enjoy. These foods are not poisonous, but they are dangerous to the teeth. So you must learn how to protect. If you are going to stick to them, stick to protecting your teeth. I'm such a sweet tooth. We're talking about oral hygiene. I'm such a sweet tooth, and I make sure that I am constantly brushing at all times. But anyway, as we wrap up the conversation, still looking in regard to oral hygiene, how often or how regularly should someone go for a dental checkup? It's recommended twice a year. That's the minimum. Okay. That's the minimum. But if you can afford, go every month. Okay. The dentist won't throw you away. Mm-hmm. And we encourage more than twice a month, because we are trying to tell people that dentistry is not expensive, but neglect is expensive. The more you neglect, the more you pay. Yes. So if you go early, make your own routine to see the dentist. Tell him, I'm going to see you monthly. If you can pay the bill for those visits, why not? Because they are small, much, much smaller than one visit in a year. Yes. It's not the many visits, it's the type of visit that
you make.
Yeah, that determines your cost.
Okay.
Yeah.
So, Madam Juliet, as we wrap up the conversation, any last message as we celebrate World Oral Health Day?
The message is, we have a camp, a dental camp at Dental School Mulago today, but we have a week-long activity running throughout the week. This is in conjunction with the Uganda Dental Association. We have today in Mulago, but Tuesday they will visit Buganda Road School. Then Saturday they will be at Makerere University Dental School. We have 2 schools. Yes. Monday Mulago, Saturday Makerere. Okay. So we call on the public, please come and benefit. Even if you are not sick, come and learn more how to care so that you never fall sick. Then come also and interact with professionals. We'll be giving oral health education. We'll be guiding you on what to eat. The basic food item that we could afford today is milk, to tell you that milk is good, and this is sponsored by Jeza Milk Products. We thank them very much. Then we thank Nice House of Plastics. They are bringing the toothbrushes on board, and Ministry of Health is supporting with the toothpaste. Okay. So please come for education, come for treatment, and come and join the dental profession as we celebrate our day. Okay. I really want to thank the dentists out there, all of you who are practicing in the oral health field. There are nurses supporting dentists. There are support staff supporting dentists. So all of you, this is our day. If time allows you, please be at Dental School in Mulago. Let us give back to the public, and we trained for them.
Well, thank you so much, Madam Juliet, for honoring our invitation and coming this morning to Sunrise at Sea to throw more light and shed more light in regard to the importance of oral hygiene.
Thank you, too, for hosting me. We'll be waiting for you.
Absolutely. Well, that was the Assistant Commissioner of Health Services in charge of oral health, and she did highlight a number of issues, including the importance of oral health hygiene. Not forgetting that all roads lead to Mulago, of course, as we celebrate the World Oral Health Day. And that wraps up the conversation that we had for you this morning on wellness, beauty, and lifestyle. However, you're still watching Sunrise at Sea, and we do have an amazing show lined up for you. Up next is none other than Apollo Sarah as she discusses, and the conversation continues on the Twitter jabs. Keep watching Sunrise at Sea.